Today, we're diving into the spicy world of ginger. But hold on, before you sprinkle it liberally into your smoothie or stir it into your tea, there's something you need to hear. While ginger is celebrated for its health benefits all over the world, there are circumstances where ginger may not be the best fit for you. So, if you've ever wondered whether ginger is a superhero or a supervillain for your health, stick around. It's about to get spicy. Number 1. Bleeding disorders. First off our list is people with bleeding disorders. You need to be careful about the consumption of ginger if you have any bleeding disorders because ginger is known to have blood-thinning properties. While this can be good news for some people, if you're already taking blood-thinning medicines, it can become a problem. For example, if you get a small cut while chopping vegetables, your finger won't stop bleeding like a normal person would. Although ginger is widely used as an herbal remedy for a variety of ailments, its potential impact on blood clotting raises concerns for people who are already at risk of excessive bleeding. The active ingredients in ginger, such as cholate and gingerol, have antiplatelet and anticoagulant properties, which can interfere with the body's natural clotting process and prolong the bleeding. If you're someone who suffers from these conditions, you should speak with your doctor before adding ginger to your diet. They will offer you specific guidance based on your distinct health profile and the extent of your bleeding. Number 2. Diabetes. Ginger is known to have the potential to lower blood sugar levels. While this may be advantageous for some people, it can also pose risks for those who are already managing their blood sugar levels due to diabetes. This can cause sudden drops in blood sugar and lead to dizziness, weakness, and even fainting. So, it is important for diabetics to closely monitor their intake. Excessive consumption of ginger may cause stomach problems for some diabetics. It may aggravate pre-existing digestive issues or even induce discomfort and bloating. In these situations, treating diabetes may become more difficult, especially since gastrointestinal issues can have an impact on blood sugar levels. Number 3. Gallbladder issues. When your gallbladder is not functioning properly, it struggles to secrete bile properly, which is necessary for the breakdown of lipids. Ginger's strong blood-thinning properties may induce the gallbladder to produce more bile, which could cause discomfort and worsen the condition. Even though ginger is well known for its anti-inflammatory and antioxidant qualities, people who have gallbladder problems should use caution when consuming it. They should speak with a doctor before including ginger in their diet because it could worsen their symptoms and impede the healing process. Instead, people who want to manage their gallbladder problems without making them worse might find it safer to use other calming and digestive-friendly alternatives like chamomile or peppermint tea. If you're enjoying our video so far, please hit the like button and subscribe to our channel so you don't miss any of our next educational videos. Number 4. Heart conditions. For people coping with cardiac issues, there are potential hazards associated with using ginger. This is mostly because of its possible effects on blood pressure and circulation. Ginger has been shown to have qualities that help improve circulation and boost blood flow, which may cause a rise in heart rate in people who already have heart issues. This can have detrimental repercussions on the heart. When ginger and heart medicine are combined, the blood may become even thinner, which could result in problems like excessive bleeding or bruises. This means that when you get hurt, your bleeding might not stop for quite a while and cause you to faint. However, you can consume ginger in small amounts in your daily diet to get the benefits of this herb. Number 5. Medication interactions. So you're popping pills to keep your health in check, but did you know that ginger might be affecting your health by mixing with your meds? If you're on certain medications, you should be cautious while ingesting ginger. This is particularly true for people who are taking medications for diabetes, high blood pressure, or blood clotting. When used with certain medications, ginger consumption can intensify the blood-thinning effects, increasing the risk of bleeding. IES ginger has the potential to induce unanticipated shifts in blood pressure and blood sugar levels, which could compromise the effectiveness of prescribed treatments. Remember, when it comes to ginger and medications, it's all about playing it safe. Because let's face it, you don't want your wellness routine turning into a pharmaceutical roller coaster ride. When you are taking any kind of medication, you should consult your doctor about the foods that you should and should not consume. This will help you with a speedy recovery and keep you away from potential health problems. Number 6. Being underweight. People usually take ginger to improve digestion, reduce nausea, and decrease inflammation. However, some people may find it difficult to maintain a healthy weight because of its inherent qualities. The main issue is ginger's ability to stimulate the digestive system. It can produce more digestive enzymes, which could speed up metabolism and reduce nutrient absorption for people trying to maintain a healthy weight. If your metabolism is increasing, it will make it more difficult for you to consume enough calories required for your body to function properly. So, should you eat ginger when you're trying to lose weight? Yes, you can, but not to the extent that it causes an upset stomach. The most common adverse effect of ginger is its propensity to accelerate the passage of food and feces through the intestines, which can lead to weakness and restlessness. According to a study which was published in Children Basal, eating more than 5 grams of ginger every day may cause diarrhea and heartburn. Additionally, ginger is known to be hot for our bodies, so we should steer clear of it in summer. Number 7. Pregnancy. Pregnant women are advised to avoid ginger due to its potential to stimulate uterine contractions. This can increase the risk of preterm labor or miscarriage, particularly in the first trimester when the pregnancy is most delicate. Additionally, ginger may interfere with certain medications commonly prescribed during pregnancy, such as blood thinners or medications for gestational diabetes. While ginger is generally considered safe in small amounts and for short durations, its potential effects on pregnancy make it a reason to worry. Additionally, it can cause heartburn, which causes heavy breathing, and that is not good for pregnant women. Additionally, bile production is stimulated by ginger and helps with digestion. However, it can cause an upset stomach and digestive problems when consumed on an empty stomach. The stomach lining becomes irritated by the gingerol found in ginger, which causes it to create more acid. It's always best for pregnant women to consult with their doctor before incorporating ginger into their diet or using it as a remedy for nausea or other pregnancy-related symptoms. In some cases, healthcare providers recommend alternative treatments or dietary adjustments to ensure the safety of both the mother and the developing baby. Number 8. Low blood pressure and cholesterol. The special qualities of ginger are a result of its active ingredients, which include zarine and gingerol. For people who already have low blood pressure problems, these compounds work as vasodilators that expand blood arteries and lower blood pressure levels. Ginger intake may aggravate these symptoms, so you should be careful while eating ginger. The ability of ginger to promote the synthesis of specific hormones and neurotransmitters, like serotonin and norepinephrine, may facilitate a subsequent reduction in blood pressure. This psychological reaction may be harmful, especially for people who are prone to experiencing abrupt drops in blood pressure. Taking too much ginger can cause you to faint and lose consciousness. If you have cholesterol, your doctors might be giving you blood-thinning medications to avoid blocking arteries, so you should avoid eating ginger with your cholesterol medication. It might hinder your progress and even cause unexpected concerns for your health. It's better to check with your doctor before including ginger in your diet. Number 9. Surgery. There are several foods and supplements you should think about taking before surgery. These substances may affect how the body reacts to anesthesia and other drugs. Ginger may increase the chance of heavy bleeding during surgery, which could make things more difficult and raise the possibility of complications afterward. Moreover, ginger naturally affects blood sugar levels, which could be problematic for diabetics since it could interfere with their usual insulin intake. Blood glucose levels may fluctuate as a result of this interference during the surgical operation. Keeping steady blood sugar levels is critical for a successful surgical procedure and smooth recovery. Healthcare professionals usually advise patients not to eat ginger because of its possible effects on blood coagulation and blood sugar management. This includes using ginger as a culinary element or as a supplement in teas. It's better to avoid ginger at least a week before your surgery. In short, the goal of this preventative action is to minimize any possible dangers during surgery and guarantee the patient's maximum safety and well-being throughout the entire operation. Although ginger is a versatile, nutritious spice with numerous benefits, it's important to know when it's best to avoid using ginger. If you have any of the problems mentioned above, it's crucial to see a medical professional before including ginger in your meals. Just a little caution and you can enjoy the health benefits of ginger without worrying about anything.